ABC4 News is putting the focus on preparation versus panic during this pandemic. For more on what you need to know about this virus, its spread, and what you should do if you should become sick, I'm joined now by Dr. Mike Baumann. He's the Chief Medical Officer with MountainStar Healthcare. Mike, so great to have you with us. A lot of people on edge now. First, what do we know about this virus and how it's spread?
Well, first, I want to compliment you on your social distancing. I'm outside. It's a tad bit cold, but appreciate the question. What do we know about this virus? It's very much like in the past MERS and SARS. It's very much to a degree like flu. But the big issue is it's a different virus in the rapidity with which it spreads. So unlike flu, which when you have flu, you might hit 1, 2 people, this hits 3 people. So it can spread very rapidly, which is the main concern we have for the healthcare systems is if we can spread that quickly, we might overwhelm the healthcare systems.
Right.
But all the systems are working very quickly and diligently to prepare for this.
Okay, let's dig into that a little more, and I do like how you brought that up. We are practicing what we preach here, so thank you for that. What do people need to know specifically about transmission?
To know about transmission, number one, this is primarily transmitted through droplets. So if you see me do this right now, it's not because I have COVID, it's because it's cold out here, and if I were to sneeze or cough, droplets come out. Unlike airborne, which is more in the air, so the droplets come out, that's why we should do coughing into our elbow, and also be aware it gets onto surfaces. And it can live on surfaces, we think, for up to 1 to 3 days, so we need to be very careful about cleaning areas where we've been. High-touch areas like doorknobs, tabletops with a lot of activity. Be very careful to keep those clean and at the same time keep your social distancing.
I was watching real-time numbers today, and to be honest with you, it's best not to do that. But what is it that makes this virus so dangerous?
Well, part of it is what I hit just a few minutes ago. It's the rapidity of spread. So it spreads more quickly, so more people can be affected more quickly. Flu happens roughly between September and March. This can happen much more quickly and overwhelm it. Plus, we know in certain age groups, particularly the elderly, and in patients with other healthcare issues like heart failure and diabetes, that they're more prone to having problems. But I don't want the millennials and other young people thinking that they're not immune. They can get this too, and they can end up in the hospital as well.
Yeah, that's something we really saw play out today, and that's the message we're hearing from the state, definitely. Talk about symptoms. What should we be watching for? And if we're feeling those, what should we do after that?
So the most common symptoms that we're worried about is fever, plus cough and respiratory issues, mainly shortness of breath. Those can be, though, a lot of other things, the common cold and the flu, but those are the main symptoms, and that's the tough thing right now is how do you tell flu from COVID? But you need to be careful and keep an eye on those symptoms, and if you have them, stay home, particularly if it's only mild symptoms. If you get worse, then you need to come in and be seen.
Doctor, we've been hearing a lot of people say, I have the virus, I wouldn't even have known it. Why is it that some are asymptomatic and others are showing symptoms, and there seems to be quite a range from mild to severe here? Why is that?
I think it's also part of what I hit just a few minutes ago, the difference between how baseline healthy you are versus how many comorbidities you have. So for example, the case that was really unfortunate yesterday that we reported was an older person who died in Utah who had other healthcare issues. So older people are more prone to it, younger people less, but even younger people can get ill. So it's a whole spectrum of how people can be impacted by this.
So as we see the numbers continue to escalate here, how is your organization, MountainStar Healthcare, and its hospitals preparing and dealing with the growing number of coronavirus patients that you could be administering to?
So we have a very proactive program across not only MountainStar, but all of our hospitals in what's called Hospital Corporation of America. We're preparing by looking at the number of beds we have, looking at alternative locations where we can have beds within our hospital, repurposing areas like the post-anesthesia care unit where we send patients after surgery. That can turn into an ICU. Taking areas that are perhaps administrative where we can move patients in there as long as we have all the available equipment like oxygen and suction. So we're looking at available space and how we repurpose it to be prepared for more patients coming in if and when, and unfortunately probably when, we get this surge.
Let's talk elective surgeries. We're seeing organizations take action there. What do you guys plan to do, and what does that mean?
So what are elective surgeries? And this has been a hot topic, not just here in Utah, but elsewhere. The first thing to understand is elective surgeries are those surgeries that are already scheduled. In our organization, we've been following the CMS guidelines, and they actually have a tiering of what should or shouldn't be done with surgeries. And we very proactively review in our hospitals, often with our CEO, our chief medical officer, surgeons, to look at that surgical schedule and be sure, is this someone should have it? I want to make a comparison. Someone who's coming in for, quote, an elective scheduled lumpectomy of the breast could have breast cancer versus someone who comes in for breast augmentation. Those are two different things. The breast augmentation should be put off. The lumpectomy, even though it might be in one of those lower tiers, really needs that to be done because it can be life-saving because the individual could have breast cancer.
Got it, that makes sense. We've run out of time, but real quick, I do want to let our viewers know how they can learn more about MountainStar Healthcare and its hospitals. What's the best way to reach out?
To reach out to us, actually we have multiple hospitals, St. Mark's, Lakeview. That's actually a great question, and I'm going to pass it to our PR folks to make sure we get, what's the best way to get a hold of MountainStar Health quickly. We have Brigham City, Cache Valley, Ogden Regional, down to Lakeview, to St. Mark's, to Lone Peak, to Timpanogos, to Mountain View Hospital. That's our system.
All right, there's one near you. So much panic out there. It's nice to get answers. Thank you so much, Dr. Baumann, for your time tonight. We definitely appreciate it.